to the community?
Yeah, sure. It has been really very beneficial. Now I have confidence in myself as a doctor to manage cancer patients. It is really very beneficial because the training I've got, not all medical officers, not all my colleagues can have the same skills to manage cancer patients.
Jacinta Ambaru Ojia is a fresh graduate of Kampala International University. She studied medicine and surgery and is among the 18 medics who have completed a week-long training in cancer diagnosis, management and care. The course is a training of trainers that was attended by doctors from various parts of the country, who will in turn train their colleagues from regional referral hospitals. The training is eventually meant to be shared with medics in all public health units.
To train other colleagues of ours who are very much involved in everyday care of many of our patients who might be among their patients who might actually have cancer. So we definitely hope and we are definitely very optimistic that this will definitely help downstage, late stage presentation as we equip many of our colleagues there with the necessary skills, the necessary knowledge to be able to have a high index of suspicion that this might be cancer.
A British professor from the Royal College of Physicians, Jonathan Joffe, says the sensitization is important for Uganda, given its development index and life expectancy.
Uganda is at a point in time where they've dealt very well with the prevalent illnesses, which are mainly infective illnesses. And as people are living longer and doing better and the economy improves, people are living longer. And cancer is an illness that occurs in older patients. And so as people are not dying of other causes, more and more people are being diagnosed with cancer, and cancer is becoming a more important cause of death in Uganda and across the whole of East Africa.
Dr. Abrahams Omoding from Mulago Hospital says the training has come in handy as the country awaits equipment to be used in the diagnosis, management and care for cancer patients.
Specialists who could be able to handle these cases, but also to be able to really address those urgent cancer symptoms that these patients will present with, things to do like with pain, things to do with like dehydration, infection that they actually have. Many a times that these patients are actually kept at the district hospitals, at the health centers, at the regional referral hospitals to wait to be referred to the Uganda Cancer Institute, of things that can actually be addressed at a district or regional referral hospital level. And by the time they come, they actually die of infection, of dehydration, of untold pain that could have actually been addressed at a low-level facility.
Uganda has in recent years grappled with the cancer ailment. This year, the government turned to neighboring Kenya for support after the country's only radiotherapy machine broke down. Kenya was not left behind.
A similar training has actually been happening in Kenya as well. That had been twinning both Kenya and Tanzania as well to train doctors on the very same topic.
The oncological training focused on research, early detection and treatment of cancer, and neurological disorders, especially in communities and areas where access to qualified professionals remains a challenge. It aimed at increasing the number, quality, and deployment of medical professionals in public service so as to cushion the burden of non-communicable diseases. Over 4 years, the program projects to have trained 600 medical professionals specializing in cancer treatment in the East African region. Ernest Wisdom Chionga, NTV.